So that it's actually a big moving field, the area of endpoints in Duchenne muscular dystrophy, and that's a combination of the science, the regulators of what they want to see, and the parents and the boys themselves. Our experience has been that the parents are extremely supportive of biopsies with some very strong provisos. There was a study not carried out by us a few years ago where biopsies were taken, but about half of them, when they reached the central labs, were unusable. Either they deteriorated, they hadn't been frozen properly, or shipping had gone wrong. And obviously that the parents and the boys, having gone through this great sacrifice not to provide data, that gave lots of issues. But our experience is that if you explain what you want it for, and then if the data is useful, then the parents and the boys are willing to give biopsies. But there are other parts of trials that can be extremely onerous, and working with the parents to work out how to make those easier. We talked about MRI, it has some big advantages, but actually it can be quite stressful for the boys. You know, if you've been into an MRI machine, I have, and they make a lot of noise, and they can be quite intimidating. So you know, the boys need support and help in all those sorts of things. And the 6-minute walk test, taking an 8-year-old boy and getting them to walk for 6 minutes, even one in perfect health, is quite challenging. And so actually working with the parents on these things is really important. We have been working with parents on endpoints. And they continue to tell us where we've got wrong and what areas that we can improve on. And that's true throughout the companies that are involved. I think this is probably the one area where I've seen the highest level of patient and caregiver involvement. But at the end of the day, we're all interested in the same objective. We want to find out if treatments can work, and we want to get them approved as quickly as possible. And so, provided that biopsy or MRI or whatever it is gets you to that endpoint, we find that the parents are very supportive of that.